Hi, I think you know who I am, but I put on a green shirt just in case. I want to show you how I do B12 shots, and with the aim of making it easy, really clear, and as painless as possible. We like to use insulin syringes. They're generally 0.3 ml. When we give you a dosage like 0.05, it's 5 on the number scale. You see the 5, or if it's 0.1, it's 10 on the number scale. That's 10/100ths of an ml. Okay? So to start out, you can back off the syringe so you can use the plunger. Have a sterilizer, peroxide, alcohol, or we use Zephyrin in the office. Wet the cotton or the Kleenex and wipe the tops of each vial. It's good to do that half a minute or a minute before you enter the vials. It takes a little time to kill the germs. I've already done that a moment ago, so I can proceed directly. The dose you're going to remove from the vial creates a vacuum in the vial. So we like to put the amount of air you're going to take out of the vial into each of the vials before you draw the shot up. So I'm going to do 10 of B12 and 10 of folinic acid. So I draw 10 of air, and put it into the B12. 10 of air, put it into the folinic acid. And now I'm ready to take out the folinic acid, which I'd like to draw up first, because it's a little bit's going into the B12 vial by cross mixing, and it's better to get folinic acid into B12 than B12 into folinic acid. So I'm going to take 10 out, and with this first draw, you're going to get a little air because of the dead space in the syringe. You can go past 10 and then push back to 10, and the measurement is at the top of that little black rubber plunger. Be sure not to touch the needle with anything except the sterilized rubber. Now I'm ready to draw the B12. I like to stabilize it with something. Go into the center of the vial and go straight in, because these needles are really flimsy. I'm pulling back with my ring finger, and watch as you go, up to 20. If you go past a little bit, there's a small amount of air left in the syringe, which is dead space. That's no problem, it's no worry. It'll push the rest of the B12 and folinic acid into the body and leave only air behind. Okay, I would recap it before you go to give the shot to your child. And when you're preparing to give the shot to your child, if you're going to do it when he's asleep, he or she's asleep, go in ahead of time with a swab, the sterilizer, pull back the jammies a little bit for the rump, or for the anterior thigh, or for the leg, or for the belly, and wipe the area and whisper, "This is mommy, this is daddy. I'm going to give you a little medicine, a little pokey, or whatever you want to call it." If the person wakes up, it's probably not going to work, and better do it when they're awake. If they don't, then go and get your shot, draw it up, get it ready, come in, and then again wipe the area and give the shot. Now I'll show you how to do the shot. Holly's volunteered. She likes them. So I'm going to sponge your arm. Got a side view so you can see the angle. Remove the top, the cap. Remove the cap from the syringe without touching the needle. Now hold the needle like a pencil tightly between thumb and forefingers so it doesn't slide. That's You have a good grip. And it's best to go in quickly and give it quickly. You don't need to pull back. Ready? 1, 2, 3. 30-degree angle. As quickly as you can, pull it out. And then you can have an ice pack ready. You can rub it. You can counter irritate it if there's fussing. And that'll really help quite a lot with the discomfort. If you're giving it with your child awake and conscious, pre-icing can be very helpful, especially with one of the blue ice things that isn't all wet. It isn't necessary. There's a small discomfort, but it's comforting to have a ritual and something to do. You know, some kids like to have a Band-Aid afterward and some sympathy and some raisins or some kind of a reward. But we found it remarkably comfortable, remarkably easy to do once you get confident and develop the skill. And the good shot giver is the one who's confident and gives it quickly. It's not that you know where to put it, that you found a place that doesn't hurt. It's just luck whether you hit a nervy area or a less nervy area, but it's giving it quickly and with confidence that makes it work. Well, good luck with it. Thank you.